Good morning, everyone. I'm here at the inaugural Women in DSO Conference at the Aria in Las Vegas, and I'm delighted to welcome my first guest, Dr. Ray Khouri, to this event. Dr. Khouri, it's a pleasure and honor to be in the same stage as you to talk about what you're planning to do in this DSO space in the United States. So, welcome to the show.
Well, thank you for having me, and it's a pleasure to be here. As far as what we're planning to do is emulate the same successes we've had in 3 other countries in launching this blueprint, which is not a startup, but a blueprint of an existing model that's successful. And we started in Australia, went on to New Zealand, then on to Canada, all driven by word of mouth by doctors.
So you brought basically these doctors that didn't want to necessarily be part of a DSO.
Correct.
But wanted the same advantages of cost savings, support systems.
All that.
All the other stuff.
And again, what was key to them was their autonomy. And maintaining their integrity. That was the key.
But how did you get them all excited around a singular purpose? I mean, it's very hard to do, right? You have one dentist cannot agree with another dentist. Now you get a whole group of people together that are leaders in their own businesses.
Correct.
How do you get them? What's the connective tissue? What would that secret sauce that you made them work together as a group?
If I had to use one word,
yeah,
validation. I know it sounds simple, but it was validation of their efforts to date and recognizing their innovative skills and making them, assuring them, I should say, that autonomy that drove their success would never be interfered with, and rewarding them ongoingly. It's all about validation, reward, and enabling.
Obviously, we know as clinicians, doctors want to be the best clinician possible.
100%.
They want to be the best dentist possible.
Correct.
And obviously, you don't want to come in that way. Obviously, never that. Right?
No.
But you want to help them be better dentists.
Yes.
Is there anything in your model that you help these doctors achieve better level? I mean, through whatever you were doing, mentorship, whether clinical support, were they able to improve their skill sets as they went along?
That's a really good question. Just to take you back a bit, the common denominator amongst all the doctors was they were all successful. What separated them was their personality, their skill set, and their aptitude.
Okay.
However, they were all successful.
I see.
What we provided was 2 things. We had a sophisticated finance team that became their support. Firstly. Secondly, the KPIs that we were sharing with them also included what other top-end clinicians were doing without identifying who they were.
Interesting.
However, that created a lot of competitive tension.
Sure.
Being type A personalities, they wanted to know why they're not the best in the group at doing what they were doing. And that's how we helped them become more optimal in their own practice, drive profits, and so on.
And so you help them understand the finances, the P&L, the profit and loss of their practice.
Yep.
You made them aware of that because a lot of doctors are not aware of that.
No, they're top line driven and they focus on what they've collected rather than what it's cost them.
And then you provided KPIs in front of them that allowed them to understand where their gaps might be.
Initially their own gaps, and then we compared those gaps to other clinicians in the group without identifying the other clinicians.
But who served as the chief clinical officer that really engaged with the doctors on telling them, hey, by the way,
I'm going to give away the secret sauce of our model if I keep talking, but there was no one doctor that became the chief clinical officer. We are talking about the best doctors in the country.
Nice.
Yeah?
Very nice.
And it's hard to give them a peer who's going to be overseeing them to say, you can do this better clinically. It wasn't about that. We had the president of the Australasian College of Dental Surgeons as part of our group.
Wow.
We had the president of the Federal Australian Dental Association as part of our group.
Wow.
So we had the who's who.
So you already had the right people on the bus.
Correct.
You just had to guide them in a way so that they got to where they want to get to from a financial standpoint and a clinical standpoint.
Absolutely.
Both. Wonderful.
And rewarding them.
So what kind of growth rates did your group see compared to what they were doing on their own when they became part of your group?
They were traditionally growing, 5% to 10% year on year. But what became even more powerful was the retention of the doctors. Our retention rate was 98%.
Wow.
None of the doctors left after 5 years.
Wow.
So that's what was the value of the platform. And that's what created the value for the smart money, whether it be the private equity groups that ended up buying into the platform or the listing that occurred in Canada. It was the retention of doctors.
Wow. So tell me about, without telling me what you cannot tell me,
Yes.
is you're going to bring what you succeeded so well in New Zealand and Australia and Canada.
Yeah.
You're bringing that same idea, same model.
So we're bringing all those learnings to the
Yeah.
biggest market in the world, which is the United States.
Wonderful.
Now, I've been in the US now for 6 months, and the reception I've received from doctors has been nothing short of extraordinary.
Absolutely.
And it just kept reaffirming what I already had experienced in 3 other countries. Doctors are the same everywhere, whether they're in New York, LA, Sydney, or Toronto.
Correct.
They're all the same. They're driven by the same fears. They're driven by the same want to be successful. All of that. It's
Right.
not unique to any one particular country.
So we're terribly excited because I have been part of this industry for a long time, and I get super psyched when new players come into the industry and they grow the industry, not only from the perspective of just revenue, but just getting more patients.
Of
we
course.
need more patients to come into dental offices.
I totally agree with you.
Right? And we've got to give our doctors support
100%.
on how to do that in the best possible way so that we can serve the most amount of patients.
Correct.
And improve health of the entire country. Right?
Absolutely.
And truly excited. I cannot wait to do this interview again.
You're very kind.
And see where United Dental Corporation, which is the company that you will do this under, does. And I'm really delighted to be in an industry which has so many innovators that are coming in from all shores of the world and trying to create and add value that our industry needs to really reach its fullest potential, which could be 10 times what it is today.
I agree. The opportunities are vast here in the US, and I have to say, I have to preface everything you've said by saying how humbling it's been for me to be here.
Thank you. It's a pleasure, Dr. Khouri.
It's my pleasure. Thank you.
Thank you.
Thank you. You're very kind.